My name is Renee Orie. I am the CEO and president of the Orie Maharaj Family Foundation, a nonprofit organization that addresses global public health issues. And this morning I have with me Professor Dr. Francis Stillman from Johns Hopkins Bloomberg School of Public Health, who teaches public health issues. And so this morning we're going to discuss the healthcare system response currently in the United States and around the world as it pertains to COVID 19. So, good morning, Dr. Stillman.
Good morning, Renee. I think you are looking at, the holistic kind of approach to this. And I think from the standpoint, like we use the socio-ecological model, which is how we address things at the multi levels from the individual, like we're trying to get individuals to follow and be compliant. And some places are much more compliant than others. Some countries there are much more compliance. They're forced in some places where there's here in the US where we're seeing better compliance than others. Then we have the issue of communication of this now. Here in the United States, we have a very fragmented system where some people are listening to one set of news and some people are listening to another, and we're not getting any kind of agreement across these. And the government has done a terrible job in communicating this. And unfortunately, they had a plan, for COVID, for a pandemic. The School of Public Health at Hopkins has been talking about pandemic and worried about it for years, and so has so many other institutions that could have been useful. And the federal government had plans drawn up, and unfortunately, our current administration doesn't believe in listening and didn't follow, or even maybe they didn't even know it was there. I don't know. So I think it I think what we're seeing is the fact that we weren't prepared. We haven't made the investments that we need to have made. And in the United States, we have incredible pockets of poverty. I've been doing a lot of work on rural areas. And if COVID-19 gets into some of these rural areas, it's going to be a disaster because the rural health centers are unprepared. We have pockets of extreme comorbidities in the rural South and in Appalachia and other places like that. You have high levels of all those comorbidities that lead to more and more mortality with this COVID-19.
I thank you. I appreciate that. I understand that because Johns Hopkins has been promoting for a long time to address public health issues, and currently with the COVID 19 and the rate at which it's spreading, it is too fast and too slow to catch up to the public health issues because it wasn't responded to in time. The current problem that I am fighting with is that there are people that are not being treated for things that are not COVID 19.
Yeah.
And so something I believe must be done. There are people who need cancer treatments. There are people who need their diabetes medication, their hypertension medication, their heart disease medications. And all these people are currently, they are just surviving on what they had prior to COVID 19. And some of them don't have any medications or any treatments that they have access to or are able to get at this point in time. And also, there are people who don't have a computer. They don't have a phone.
That's a problem, especially for children.
They don't have access to
They don't have access to the internet. No,
there's people who are homeless. There are people in shelters. They don't have access to these tools, and they're the ones that are most at risk. The homeless and the people who are in these high congregated areas. And
no, that is really true. And I don't think, in the beginning, I think it's starting to be reported, and I really have no idea, who can step up. I have seen some stories about the food banks that are just being overwhelmed, but they've been stepping up and trying their best to get food to people. But it's just there's so many issues, like the prisons and Yeah,
That's why I'm gonna continue fighting. I'm hoping to raise awareness of what is going on in a holistic point of view, and not just be focused on just simply the COVID-19, but those at risk for COVID-19 as well in our societies across the United States and across the world, because we're not the only country that is dealing with these things. And we're not the only country that has public health issues. Exactly.
Refugee camps, yeah.
There's
So
refugee
I
camps.
that we now have a vaping epidemic in this country. That was on the
Yes.
news for quite a long time because there were up to 2,400 deaths related to vaping.
Yes.
Now the stories are coming out that it's putting these young people and anybody who's doing it at higher risk. So this pandemic that we're experiencing now is showing all of these other connections.
Exactly, because there's those deaths due to the vaping plus the COVID-19 ones. And then the addition of both combined. Right. Because those who were vaping are at risk.
Yeah, and now they're saying, to these young people who didn't think this was a problem, you're now at higher risk. Now there's time for you to do something if they can. So I think that's what I can add to your quest to get some more information on this.
Well, thank you so much.
You're welcome. Nice to see you. Nice to meet you in person.
Yes, and I appreciate all that you have done for me and for teaching me so much about public health issues and making me aware of them, that I have a voice now to voice my opinions on them.